Hello and welcome. You're watching Medically Speaking, and I am Meenakshi Upreti. It's a very special episode. We're going to be talking about hepatitis today. Now, many of you may wonder, why are we talking about hepatitis? Because it's the World Hepatitis Day. What's the significance of this day? To begin with, we will simplify this topic for you. What is hepatitis? Is there a prevention? Is there a cure? And in case you have it, how do you go ahead? To discuss the same, of course, I have a panel of experts with me as usual. I have Dr. Arora. Dr. Anil Arora is the HOD of the Gastro Department of the Gangaram Hospital. I also have Dr. Sanjeev Sehgal with me. Dr. Sehgal is the Principal Director, Liver and Hepatology. He's, of course, from the Max chain of hospitals. And also, I have Dr. Sudeep Khanna. He's from Apollo. He is a Senior Consultant of the Gastro Department. He's from the Apollo chain of hospitals. Thank you, doctors. Thank you very much for joining us. I'm going to start with you, Dr. Sehgal. When we speak of hepatitis, why is it such a crucial problem? Right now, many of my viewers may think, well, it's coronavirus. Why is she even talking about hepatitis? But I was just going through some numbers and I jotted some of them down because they are very, very startling and they should really almost scare everyone. One person, according to a WHO report, dies of hepatitis every 30 seconds. Now, these are hepatitis-related illnesses, viewers. Now, if you even see what's happening in COVID, I don't think a person is dying every 30 seconds globally due to COVID. Perhaps that's why the theme of World Hepatitis Day also is that it cannot wait. We need to talk about hepatitis. We need to look at cure, prevention, and much more right now. Over to you, sir.
So hepatitis is a huge burden in our country, as is it in worldwide, and you'll be really surprised to know that the burden of hepatitis in India is actually still continuing despite the advances which you had in medical sciences. Now, what is hepatitis? Hepatitis basically means inflammation of the liver. The liver is inflamed, and the prime reasons for hepatitis in our country are the hepatitis viruses, which are of mainly 4 types: the hepatitis A and E and B and C. We divide them into 2 groups. Now, A and E are self-limited. They are spread through blood, water on a fecal route, and usually are self-limiting. But hepatitis B and C are huge burden in our country, and they are spread by parenteral route. That means by infected body fluids and blood and all. And in India, if you look at the burden, hepatitis B has a prevalence of about 2 to 7%. And hepatitis C has a burden of about 0.5 to 1.5%. So they constitute a huge number of patients who have this infection in the country. And these are very important cause of liver-related deaths in our country. They not only cause liver inflammation, they cause liver failure, they cause cancer, and so on. So I think that this World Hepatitis Day on 28th July is absolutely on the right direction, where we say that hepatitis cannot wait, and it should be our topmost priority to curb this disease at the earliest, prevent its transmission, prevent its spread, and treat it at the earliest. So we can discuss this in more details as we have this panel going on.
Well, absolutely.
Thanks,
and Dr. Arora, I would like you to come in here. Dr. Sehgal very rightly spoke about what an endemic problem it is and how deep rooted it is in India. Again, taking you through some numbers which I've collated: 40 million people HBV infected. Apologies. That, if I see, it's almost 11% of the global burden of hepatitis. So as far as India is concerned, it's something we should be discussing right away, because it really is an emergency, isn't it, Dr. Arora?
Yeah, thank you, Meenakshi, for having me on your show. I think it is very pertinent that you have tried to raise an issue which is of far more importance than corona alone. There is no doubt corona is a big pandemic, but we should understand that corona will come and go. But conditions like viral hepatitis have come and have not gone back. They have stayed. The basic difference between corona and the viral hepatitis, we know very precious little about corona, whereas we know every damn thing about these viruses which affect the human beings. There are 2 types of viruses, as Sanjeev said. The one which are transmitted by the fecal-oral route, that is contaminated food and water, which are totally preventable. This is a disease of developing in poor countries like ours, like in India or the South Asian countries, whereas it has been practically eradicated from the developed world. So simple provision of the safe drinking water and hygienic education is something which can prevent this menace of hepatitis A and E. But the biggest problem lies with parentally transmitted viruses, hepatitis B and C, which are neglected. As you very rightly said, there are about 40 million carriers of hepatitis B in India. And unfortunately, majority of them, they do not even know they are carrying this virus. So not only are they a threat to themselves in terms of disease development, but they are also a potential source of infection to the family. So with this increasing awareness, we can not only diagnose them, but prevent their siblings, their children, their families.
And you've raised such an important point, Dr. Arora, because the more I read about it, the more I was just looking for statistics, but the more I read about it, and Dr. Khanna, perhaps you can come in here, the more I read about it, and more I realized that as far as hepatitis is concerned, of course, it's hepatitis B load, which is pretty high, significantly higher in India. The bigger problem is awareness. You prevent yourself also when you are aware. Forget reaching the point of treatment, far as immunization is concerned, far as regular checks are concerned. Would you say that there is, as Professor Arora just said, and very rightly so, there is a lack of awareness which we need to tackle right away?
Meenakshi, thank you for having me on the show. And Dr. Arora rightly said that there is lack of awareness. I would add another part to it one is lack of awareness, another part is that something like this exists, but you're not ready to accept it.
Yes.
Right, because we know the biggest prevention against hepatitis B is vaccine. Right. So in a not too far ago, study was done in children from India, almost 1 lakh children, and they found out that only approximately 50% of these children were vaccinated against hepatitis B. So 50% were not.
So I'm going to interrupt you here and I have one more question, just a follow-up question to you only. Isn't it covered under universal health immunization?
Yes, I think 2009 onwards is a part of that, but still,
so why are children not vaccinated?
Yeah, no, the same reason, people are scared of COVID vaccine. What is happening? So, the anti-science lobby everywhere in the world is so strong that it becomes a problem for us to help people, unfortunately. That is, about the vaccine. Yes, we need more information to be spread about hepatitis B, how it is transmitted. And, deliveries happening in villages, no mother is tested for hepatitis B. And in India, vertical or horizontal transmission from the mother during delivery and during close contact for first 5-7 years of life is one of the most common causes of transmission of hepatitis B. So, people need to be educated and tested. It is about being tested and treated and prevention.
Right, absolutely. Testing is crucial when it comes to prevention. But, Dr. Arora, we very rightly spoke about how people are not even ready to accept it. So clearly there's a lot of stigma around it. What can we do? Because there are a lot of laymen who are perhaps watching this show. What can they do to begin with to end this stigma around hepatitis?
Yeah, if you look at the stigma, it is more to do with hepatitis B than with hepatitis C. You'll be happy to know, Meenakshi, that for hepatitis C, now we have a discovery of these wonder drugs called DAA, in which just one pill per day for a period of 3 months can cure almost any type of hepatitis C. So this is absolutely curable. The hepatitis C is as curable as any other bacterial or viral illness. Problem is with this hepatitis B. But the biggest problem with hepatitis B is people are not aware of it, that they may simply be carrying the virus in the blood for ages before they come down with an advanced liver disease called cirrhosis or presenting for the first time with an advanced hepatocellular carcinoma. So my advice will be anybody who has had blood transfusion in the past, anybody who had major surgery, tattooing, needle prick, trauma, or even dental manipulation at any point of time, do get check up for hepatitis B. In case you are incidentally carrying the virus, there is a very good therapy which is available, which will keep you totally safe and prevent you from very, horrendous diseases like cirrhosis and HCC. And if you are not protected, please get a vaccination. Now, coming to the vaccination for hepatitis B, we are running from helter to shelter to get a vaccine for COVID, which is available only for last 6 months with a limited history of efficacy. Whereas this vaccination for hepatitis B is available with us for 3 decades. It is dirt cheap, very safe, very effective, and also gives you 100% protection. So we are doing a national survey, and I believe that very small population in India is aware of this fact that the vaccination is available, which is very cheap, effective, and gives you a complete protection. So the least we can do is at least those who have been exposed to blood transfusion should get themselves screened. And if the virus is picked up in the early course of the illness, you can be totally cured of the liver disease.
Sure. Dr. Arora, when we speak of prevention, when we speak of cure, what really can someone do who is already infected with hepatitis B? Prevention, where you spoke about screening, testing, awareness, education, that's the foremost, step which everyone needs to take. But Dr. Arora, what about cure?
Yeah, there are two aspects to a patient who is suffering from hepatitis B. Mm-hmm. Unlike other illnesses like tuberculosis or coronavirus or any other illness, you either have a disease, you either recover from it, or you die of the disease. Whereas unfortunately in hepatitis B, if you get an infection today as a totally novice virgin person, then 5% chances are that as an adult, you will carry the virus in the blood for after 6 months. That is called chronic carrier state. Unfortunately, once you are a chronic carrier with hepatitis B, you will almost always remain a lifelong carrier. And these are the very people who are likely to develop disease later on in their life. They continue to be symptom-free. They do not think they have a disease, and hence they do not bother about it. See, in a developing country like India, where the problem is that of employment, for getting the bread, for getting your housing, for having the basic livelihood. So the priority which is given to the management of hepatitis B always takes a back seat. So that is where the role of screening and testing comes. If a person who is incidentally positive for hepatitis B, if he has a regular checkup, can be treated with antiviral therapy, he can have a practically normal life. At the same time, once he is infected, he has a potential to transmit the infection to his wife, to his siblings, to his children. So if they can all be prevented, so it is a chain of events. If one person can be prevented, other can be prevented also. It's like in coronavirus. If you are getting vaccinated, then you are contributing to the community because you will not be a spreader subsequently. And if a lot of people get vaccinated, you get a herd immunity. Similarly, in hepatitis B, if one family member is protected, it is a good, onus on them to protect their families and the children. So in early diagnosis, regular follow-up and prevention of the family members goes a long way in preventing major complications, which come later on.
Right. Dr. Khanna, when we're speaking of COVID and hepatitis, because there is, of course, a fear of nowadays, even the third wave looming on our head. And those who already are infected with hepatitis, are they furthermore immunosuppressed? Because we've seen that in liver cirrhosis patients. Tell us more about it. Are they at a greater risk in case they get COVID?
Actually, if they do not have cirrhosis, right, whether it's hepatitis B or C, they are no higher risk of getting the infection. Even if you are a cirrhotic, you are not at high risk of getting the infection. Problem could be once you get infected. Then if you are a cirrhotic and it is decompensated in the form that you have fluid in your abdomen, or your bilirubin is high, your albumin is low, your PT-INR is high, that means liver function has really gone down. Then you are at increased risk of complications of COVID. This is the group, where the outcome may be poor. But otherwise, a compensated cirrhosis who has mild COVID does not need to worry much. And being infected with hepatitis B or C does not mean that you have higher chances of getting COVID. That is absolutely wrong.
No higher chances of getting COVID, but the fear, of course, also looms in the mind of death when of these patients. But okay, rightly mentioned, it's more risky for those with liver cirrhosis. Those with hepatitis, of course, can go ahead. And as Dr. Sehgal also suggested, they should continue both their medication, even if they're given steroids. But Arora, go ahead, sir. Go ahead.
And that is the reason, there should be no fear of getting vaccinated. That is why vaccination is so important.
And that was the next point I was going to take you to, Dr. Arora. You sort of answered it for us. So Dr. Arora, no fear of vaccination for those who have hepatitis. Dr. Khanna, though, has sort of answered that question for us.
Yeah, as Dr. Sudeep very rightly said, once you have a liver involvement from any cause, be it non-alcoholic fatty liver disease, hepatitis B, C, post-transplantation setting, or alcoholic liver disease, you already have a compromised liver. Liver is an extremely vital organ in tackling so many processes, including metabolism of the drugs which are given for COVID, including immune system which needs to be coming from the liver only, and also, as it also it is affected by so many other mechanisms which tend to occur in patients who have severe COVID. So once you have a severe COVID, liver is likely to be involved in majority of the patients. So that is where the borderline functioning of the liver will certainly put it down. So all the more reason patients who have an underlying liver disease, be it fatty liver, hepatitis B, C, it's not that they should not have it. In fact, they should be given the vaccination on a priority basis. Even though we know very well that the vaccination induced antibody response may not be as robust, it may not be as brisk and as in a person who does not have a liver disease, but still, whatever it is worth it. Rather than trying to push them back, they should be put in the front line, because liver is a vital organ which is going to handle all the drugs which are to be given to the patients with the severe COVID, or the drug or the systemic inflammatory response of liver, of which liver is an important component of handling for.
Right. And Dr. Sehgal, since we are talking about coronavirus, and of course, those who already have hepatitis, the one thing which comes to my mind as we're all discussing is the importance of early diagnosis, of early treatment. In which patients, do the conditions worsen so much that perhaps it could lead to liver cirrhosis and furthermore complications?
Right. I think the point is very clear that early diagnosis is very important in hepatitis treatment. Usually, if you say rapid deterioration, that happens in patients who develop what is called as acute liver failure, which is something like you have a simple jaundice because of hepatitis A or hepatitis B, for example, which you have had earlier, because of contaminated food, roadside food you eat, salads and all, and then you develop a jaundice. Now, sometimes in a very small percentage, this patient can develop rapidly, developing jaundice, can have altered sensoria, may become drowsy, and they have to be taken to hospital, and you find that the blood is not clotting well. And then they actually need an ICU admission. So that's a rapid deterioration which is seen in these patients. This is called acute liver failure. Second group is those who have got a chronic disease like hepatitis B or C or non-alcoholic fatty liver disease. They are stable, they are in their homes. Then they develop a superadded infection. Like they may, in fact, it is known that even with a new infection like pneumonia or COVID or anything else, or a viral infection, hepatitis A or E, on top of that, this is called superadded infection. Then they develop a liver failure, which is called acute and chronic liver failure. So these are the two situations where a patient will have a rapid worsening, will need to be going to the hospital emergency, will need an ICU admission. And in both the situations, quick diagnosis and early start of treatment is very, very important to save these patients in a timely basis. They're really critical, I would say.
Quick diagnosis, early beginning of treatment is important, but we're almost reaching the end of our debate. And Dr. Khanna, I think at the start you just mentioned that a lot of people are not even aware that they are living with hepatitis. How would perhaps a person know that they are living with hepatitis? We spoke of the urban-rural divide as well. We spoke of lack of awareness. What are the symptoms which one can look out for? Because many, as we're rightly talking about, are not even getting screened.
That's a very good question, which has actually no answer. I'll be very frank, because unless you develop acute liver injury, that is, you develop jaundice or something, or loss of appetite, fever for a few days, you will not get tested that what is happening. So for most of the patients with hepatitis B and C, patient is just asymptomatic. They may be picked up, they have gone for, let's say, gallbladder surgery. So in most of the hospitals, bigger setups, you would test them for presence of hepatitis B, C, and HIV as a routine pre-surgery, and you pick up these patients. Or someone has gone to donate blood component for someone who's admitted. So this blood will be tested before it is used on someone else. These infected people may be diagnosed, okay, this individual has hepatitis B, C, or plus minus HIV. So otherwise, for hepatitis B patients to find out based on some symptoms is not possible unless the liver disease is far advanced. Right. For hepatitis C, of course, tiredness is a predominant symptom in some patients. So if you have fatigue throughout the day with no other explanation, the other common factors being vitamin D deficiency, thyroid problems, or any other hormonal disorder, then one must check themselves for hepatitis C infection. Fatigue can be a predominant symptom with hepatitis C. But for B to have a specific symptom, which make one thing. The other thing is, if you have any family member with hepatitis B, then it's very simple and there's no confusion that you need to get tested. Otherwise, it's very difficult to pick up. That is why you have to screen at least the higher risk population, all the pregnant ladies. So maybe we can achieve some better results with that.
Yeah, but in most pregnancies, it is a mandatory screening
Yes,
nowadays, maternity
yes,
hospitals at least. Yeah.
absolutely, absolutely.
Yeah, Dr. Arora, we spoke about who all should get tested, how important it is for testing. You're really an authority in this field, sir. What will be your suggestion to policymakers of this country, perhaps, who are watching this show?
Yeah, my practice is totally different. Anybody who comes to me, I as a routine screen for hepatitis B and C. As rest of the panelists have very clearly said, that if we keep waiting for the symptoms to be present before we make a diagnosis, and we presumably under a wrong impression think that we have picked it up at an early stage, I think we are mistaken. The only way to pick it up and diagnose early and start treatment is by doing the test. So my suggestion is, anytime you go to a doctor for any disease, so if you're getting your blood test, now we have this card and kits available which are very cheap and very sensitive and specific. Just get a screening test done for hepatitis B and C, which is a routine thing. A lot of pharmaceutical companies do come and help you. They'll have camps, you can have Lions Club, Rotary Clubs, Welfare Association. Why not? Anybody and anytime. An executive checkup is becoming a routine. Everybody just gets everything done.
Not really, I'm sorry I'm interrupting you, but you're talking about every second person should get a check. But if you look at those routine health checks which people get annually, because my whole family does, I don't remember any of us getting hepatitis test at all.
Absolutely. That is what we need to make it different. That is what I raised the issue in my own hospital. In a routine checkup, if you are testing for hepatitis, testing for blood sugar, urea, creatinine, thyroid function, I think it should be mandatory, because this is something which is totally treatable. This is something which is preventable. And if you do not pick up in an asymptomatic individual, the cost of the treatment which you have to pay, that is totally horrendous and enormous if the patient develops a long-standing liver disease. So it depends on where you are practicing. I, as a policy, ask all patients, and none of my patients ever refuses to get these tests done. And see, all executive checkups, all Lions Club, Rotary Club, they can simply have one-time drive. And even if you pick up 1% of the population, it is still cost-effective in terms of treating the patient at an early stage of the disease, preventing the spread amongst the family members. And this may have, onerous complications, especially if you pick it up in a young unmarried men and women who wants to get married. It is a nightmare for them. But if you treat them well, if you make them safe for their spouses, I think we'll be doing a human service to them.
I've seen a very interesting advertisement which has said, when we go to these matrimonial websites, we look at the salary packages. Why don't we look at hepatitis and HIV status as well? But Dr. Sehgal, I personally think we're a little far away from that as a country. We spoke of stigma, lack of awareness. Who are these people? Of course, we had Dr. Khanna tell us pregnant ladies, of course, need to go for that screening. You have those who are living with others in their family who have hepatitis. They are the ones who could be at a higher risk and must get screened. But in your view, sir, one, who all should get screened? And secondly, anything we can do to prevent it other than screening, other than vaccination?
I mean, see, the screening is, as Dr. Arora just mentioned, is something which we should follow in our practice in a universal way. And we have to identify the high-risk population, which we have already discussed. People who are drug abusers, for example. If you are having, a family member who's positive hepatitis B or C, you have to get it checked. If you have a liver disease already or some other problem which makes you more prone to liver problems, then there are people who actually have high-risk behavior, like things which can, spread the virus. So we also need to know how this virus is spread from one person to other. Common is, going to a salon and getting a shave, the razor which is used, maybe it's the contaminated one and maybe the source of it being transmitted to many people at the same time. Sharing of toothbrushes, then interpersonal relationships, you have to be very careful. Somebody in the family has got, hepatitis B or C and the blood, which spills out. You need to know how it has to be cleaned, because even a small, minute particle of the blood is sufficient to contaminate it to other person. Then people who take dialysis and all for renal problems, for kidney problems, the dialysis center where it is done, it has to be following all the protocols that it is following very strictly, blood transfusions. So these are the things which make a person prone to hepatitis B or C. People who are actually, for example, having some problems of immunity,
Wi-Fi.
transplant diseases,
This
they
is
are again more prone to the infection.
Right.
So, so I think that we need to understand which are the high risk groups where this virus is transmitted from one easily. Then we should follow a universal practice of screening these people. We should focus our attention to the group where we can have maximum outcome as far as screening is concerned, and you can treat them at an early stage.
All right.
So that is my message. So be aware, screen early, test early. The more you test, the more you're likely to pick up the problematic group in society, and then you can treat them at the early stage.
All
That
right.
would be my message to the
All right.
society.
Last question to you, Dr. Khanna. It is something which we can eliminate. What do you suggest the government, perhaps policy makers, medical institutions, doctors, even the common man, last word to you. What do we all need to do to eliminate hepatitis? Because that's something which can be achieved. At least it's a goal which we can think of perhaps many years later from now on.
Very true. It's not that we cannot defeat hepatitis B infection, but as an individual, I can only think of, a vaccine being made mandatory, which is very difficult in a democracy. Right. Short of that, nothing else is going to help, as far as my, limited opinion is. And individually, high risk behavior, as Dr. Sehgal said, if you can avoid those behaviors, then transmission gets reduced. But without vaccination, vaccinating every newborn for next maybe 20 years will not be able to reduce the burden of hepatitis.
Seems a little bleak, but certainly we have the throw of suggestions from our experts. I think Dr. Arora gave a very interesting suggestion. Since we all go for annual health checks, we all have corporate health checks. Why not hepatitis? Why not include perhaps even HIV? Interesting conversation, food for thought. I hope also people are listening, and I hope some of your ideas do get incorporated. This was a special show on hepatitis. If you do like it, subscribe to our channel on YouTube as well, and also subscribe to us on our website medicallyspeaking.in/news. Thank you for watching.